Everyone, my name is Okoro Blessing Nena. I'm from Group 28. I'm here to teach you how to examine and notice signs of heart failure. What is heart failure? You must have heard about it. Heart failure is the refusal of heart to pump blood. The heart is like any other muscle. It gets tired because of too much pressure on it to pump blood. Because this is affected by age and is usually heart failure usually occurs in elderly patients. So also heart failure is is really affect the patient and then can affect the pulmonary respiration of the patient. So sometimes you see one of the signs, you see the patient coughing. My patient just told me that she cannot breathe well, so I'm going to tell her to take a deep breath, breathe in and breathe out. She is having autopnea. She can only breathe well if she sits down. Then the next sign will be dyspnea. Like if the patient cannot breathe well totally, you have to put the patient's leg in a Fowler's position and raise the bed alignment up. Then give the patient an inhaler. That's how we help the patient with dyspnea. What's the next what's the next thing to do? In case the patient is coughing, you can even see the patient spitting blood, so that is another sign. Another sign is to check the legs. Check the leg of the patient for any swelling. My patient's leg is swollen. There is an edema on the leg. Why does this happen in patients? Because there is failure to pump blood and other fluids. The fluids go and hide in the tissues. This is where circulation starts. So this is where leg edema, this is what causes leg edema. So what's the next sign? I'm going to check her neck in case there is vein swelling. The the veins on the neck, the jugular vein on the neck is swollen, so this can be also a sign. It can also be a sign. So what's the next thing? I'm going to check the patient's blood pressure, but before that I'm even going to ask the patient how is she feeling. So, madam, how are you doing? Okay, are you feeling any signs of tiredness? You are feeling tired, are you sure? Okay, were you able to lie down flat when you were asleep yesterday? You weren't able to lie down flat. Okay, so we have two more signs. She's feeling tiredness and she was not able to lie down flat while she was sleeping last night. So now we're going to check her blood pressure and her pulse with this Omron blood pressure machine. So as you can see, I'm checking her blood pressure. It's going to take some time. Oh my gosh. Her blood pressure is really high. Her blood pressure is 138 over 90. So we can see that the blood pressure is really high. We're going to check the pulse. Okay, we're going to check the pulse. The pulse too is high. Her pulse is about 110 per minute. 110 per minute, and it's increasing. It is rapid. It's not regular. It's very irregular. It's changing. 110 now is 100, 115, and the pulse is changing. This is another sign. High blood pressure, irregular pulse, rapid pulse. So these are other signs. Okay, so what do we check next? We are going to check for pulse deficit. We are going to use a stethoscope to check the pulse in the heart area, in the thoracic region. Then at that same time we are going to check the pulse of her radial pulse. If there is a difference between these two, between the contractions of the heart, that's the heartbeat, and the radial pulse, that means it's also a sign, pulse deficit. Okay, so now If there is a stethoscope, you have to check her heartbeat so that you can know how the heart is beating. If her heartbeat is like kind of rapid or too fast, it is also part of it. And then also at the ending stage, you will see some, as you can check that one needs like a proper machine to check the liver, to check liver failure, because that's after lungs, the next organ is the liver that gets affected by heart failure. So I think these are all the symptoms that we need to know about. And another one is ascites. That's, it's like fluids packing up in a region of the body. It's almost like leg edemas, but this one, it doesn't have any specific organ. It can attack any part of the body. Okay, so after liver malfunction, you can even have kidney failure, but this is after the ending stage. So this is how to notice and examine signs for heart failure. Thank you so much for listening.